It's great to be here and see all these familiar faces. This is my good friend, Dr. Brenda Oyer, and I thought she could just say a few words about her background.
Good morning. I'm just really pleased to be here this morning. I have a doctorate of education in leadership studies from Bowling Green State University, which is how my path with Priscilla crossed, and just have been really passionate about the pro-life cause for a number of years, and recently with all of the newer legislation that has been passed, especially what happened in New York, I contacted Priscilla and I said, what can I do to help? So that's why I'm here, and really pleased to be a part of this.
Great. Thanks, Brenda. All right. So the title of our talk today is Abortion and Mental Health, a critique of the National Academies of Sciences, the NAS report on the safety of abortion. And then I'm going to do a methodological analysis, provide the results of a new study that I've been working on for about a year, looking at everything that's been published from 93 to 2018. So the presentation objectives are first to provide an overview of the NAS report on the safety of abortion, focusing a little on bias of the organization generally, and Dr. Oyer will cover that. Consider the methodologically deficient NAS synopsis of the abortion and mental health literature. It really was deficient. It was ridiculously deficient. And then discuss a comprehensive and systematic analysis of the world literature on abortion and mental health. So I'll let Brenda talk a little bit.
So I'm going to just go through this part really quickly so that we can get to the heart of the issue, which is Priscilla's research. But the NAS, as many of you may know, is a private nonprofit society, and it's comprised of scholars, and it was founded 156 years ago during the Civil War. The bill for the incorporation of the NAS was actually signed into law by President Lincoln, so it's been around a long time, with its primary purpose being service to the nation. And as it states on their website, the NAS is committed to furthering science in America, and its members are active contributors to the international scientific community. And nearly 500 members of the NAS have won Nobel Prizes, so it's, obviously has a very prestigious track record. A little bit more about the history. In their guidebook to best practices titled On Being a Scientist, the following statement is made. The scientific research enterprise is built on a foundation of trust. Scientists trust that the results reported by others are valid. Society trusts that the results of research reflect an honest attempt by scientists to describe the world accurately and without bias. But this trust will endure only if the scientific community devotes itself to exemplifying and transmitting the values associated with ethical scientific conduct. And I know we've already heard in the first two presentations this morning that there's definitely an issue of bias, which we're going to talk about. So there's been a great deal of policy-oriented work that's been conducted through the NAS work, with thousands of experts providing volunteer service on hundreds of committees that have convened to examine pressing social issues. And the NAS currently includes approximately 2,100 members. But unfortunately, the NAS today has deviated significantly from their founding ideals that I talked about in the previous slide. So we do see significant conflicts of interest in the work of the NAS committees. Because the NAS has long maintained close ties to the industry, this has raised conflicts of interest allegations. And that's often directed at the committees of the invited scientists who are actually authoring reports. A comprehensive analysis was published in 2006 by the Center for Science in the Public Interest, which I'm going to call CSPI. And they are a consumer advocacy organization that provides consumers with current scientific information about health and well-being. And the document they published was titled, Are the National Academies Fair and Balanced? CSPI concluded, unfortunately, we found serious deficiencies in the NAS's committee selection process that could jeopardize the quality of future NAS reports. The NAS has allowed numerous scientists and others with blatant conflicts of interest to sit on committees. Compounding the problem, those conflicts of interest usually are not disclosed to the public. So just as an example, just last year, similar allegations were raised against the National Academies of Science, Engineering, and Medicine in the highly respected journal PLOS ONE, and those allegations were raised by Krimsky and Schwab. So according to Krimsky and Schwab's study, their study examined whether there were any financial conflicts of interest among the 20 invited committee members who wrote the 2016 report on genetically engineered crops. This is just one example. And they concluded it's notable that the committee members we identified as having financial conflicts of interest comprised all of the committee's expertise on key topics. And just as the NASM did not disclose any financial conflicts of interest among its committee members, it also did not disclose institutional conflicts of interest. So we see a theme here. At the time, the NASM was developing its 2016 GE crop report. It was receiving money from agricultural biotechnology companies that have a financial interest in the study. The organization's annual financial reports do not give exact figures, but note that 3 leading agricultural biotechnology companies, including Monsanto, DuPont, and Dow, had given up to $5 million each. So, that's just like one example, that there are also of conflicts of interest, and what we're going to talk about here is that there are also significant conflicts of interest relevant to the NAS report on the safety of abortion.
Thanks, Brenda. All right. So, as described in the NAS report, the impetus for review of the evidence on the safety of abortion did not originate with the NAS, but with the funding sources. In 2016, 6 private foundations came together to ask the NAS to conduct a comprehensive review of the state of the science on legal abortion services in the U.S. The sponsors, some familiar ones here, included the David and Lucille Packard Foundation, the Grove Foundation, JBD Foundation, Susan Thomas Buffett Foundation, et cetera. Each funding agency has provided significant financial support to abortion providers and/or donated large sums of money to pro-abortion population control initiatives. We'll consider one example. The Susan Thomas Buffett Foundation is described by Callahan as the largest non-governmental funder of reproductive health and family planning, including extensive investments in abortion and contraceptives worldwide. The Media Research Center estimated that the foundation gave over $1.2 billion to organizations that advocate for pro-abortion policy, perform abortions, or assist with the development of medication abortion. The center further reported that as of 2012, the foundation had provided nearly $300 million to Planned Parenthood clinics and to its national headquarters. Martin, in 2016, reported that Susan's husband, Warren Buffett, donated at least $88 million from 2001 to 2014 to the University of California, San Francisco. This is a medical research institution with a very strong reproductive health infrastructure. Martin interviewed Tracy White's former director of UCSF's Advancing New Standards in Reproductive Health Project, who commented, and this is interesting because we've been conducting so much research showing the ill effects of abortion, so the other side is very much invested in countering that. So she commented, there's been recognition in the philanthropic community that in order to make progress, either culturally or politically, or in the service delivery arena, there are research questions that we need to answer. Martin further commented that for several years, foundation-backed researchers have churned out studies aimed at debunking common justifications for abortion restrictions, including, quote, that clinics were teeming with incompetent and unscrupulous doctors, that injured, abandoned patients were flooding emergency rooms, that the psychological damage caused by grief and regret after abortion often persists for years and ruins women's lives, Not surprisingly, the primary focus of the review of literature on abortion and mental health in the NAS report involves many studies published using that same data set, the UCSF highly funded Turnaway study. And several of the NAS report committee members have associations with organizations that have supported unrestricted access to abortion, such as the Kaiser Family Foundation and the Reproductive Health Program at the Bill and Melinda Gates Foundation. Notably, none of the committee members appear to have a research program specifically related to abortion safety, seriously questioning their expertise. And many of the reviewers of the NAS report are directly involved in provision of abortion services or have connections to pro-choice organizations, revealing significant conflicts of interest. And I'm going to have Brenda talk about a couple of these. One's been in the news this past week. Here he is.
Yeah, so this is Willie Parker. He's a medical doctor. He's a board member of the Religious Coalition for Reproductive Choice. He received Planned Parenthood's Margaret Sanger Award, which is the organization's highest award. Also received the Champions of Choice Award from NARAL and the George Tiller, MD, Abortion Provider Award from Physicians for Reproductive Health. So he is a non-biased committee member, reviewer.
I think he's going to jail now, too. It's looking like.
So according to a Newsweek interview, he estimates that he performs at least 1,000 abortions a year and has completed more than 10,000 over his career. And as Priscilla mentioned, he's recently been in the news for allegations of getting women drunk for the purpose of sexually preying on them. And many of these women who are accusing him of this are abortion industry workers. Daniel Grossman is the Director of Advancing New Standards in Reproductive Health at UCSF, which we mentioned in a prior slide. He provides abortion as a consultant to Planned Parenthood Shasta Pacific, and he serves as liaison member of the Planned Parenthood Federation of America National Medical Committee. And in 2010, at a National Abortion Federation annual meeting, Grossman received an award for IBIS's research evaluating the use of telemedicine to improve access abortion in rural settings. Again, another example of unbiased.
I know Daniel Grossman a little bit. I've been working the last couple of years pretty extensively with Missouri and with Tennessee and some other states, helping them defend their abortion restrictions. And he's often the one I have to rebut in these reports. We've gone back and forth with rebuttals. So it was in March 2018, a little over a year ago, that the NAS report was released, and then 6 months later, the over 200-page document has now quickly made its way into the reports of experts like Grossman, charged with challenging various state-level restrictions on abortion services. In the report, this is the conclusion, their general conclusion: legal abortions are safe and effective. Safety and quality are optimized when the abortion is performed as early in pregnancy as possible. Quality requires that care be respectful of individual patient preferences, needs, and values so that the patient values guide all clinical decisions. At least acknowledge that. They don't do that. But the committee did not identify gaps in research that raised concerns about these conclusions. The NAS Committee's conclusions regarding the safety of abortion are drawn from a significantly skewed synopsis of the professional literature, one that profoundly minimizes risks to women. Large segments of the peer-reviewed literature are ignored. Further, the NAS Committee generally failed to provide clear information regarding the standards employed to select and evaluate individual studies in formulating general conclusions. So we'll look at the Mental Health Association from the report. They ignored the majority of scientific studies that published, focusing, as I said previously, mostly on that Turnaway study. There have been numerous publications generated from that, basically concluding that having an abortion does not increase a woman's risk of various mental health disorders. The Turnaway study results suggested serious consequences of being denied a wanted abortion relative to women's health and well-being. The most egregious methodological problems of the Turnaway study, rendering the results completely unreliable, are covered briefly here. You've probably heard critiques of it elsewhere, so try to move through this quickly, but only this is really bad. Only 37.5% of the women who were invited to take part in the study actually participated, and across the study period, 42% more dropped out, so their sample is based on 22% of those eligible for inclusion. The authors also failed to reveal the specific consent to participate rates for each group. The three groups were a first trimester abortion, a second trimester near limit abortion, and denied abortion due to being past the gestational limit. Second trimester abortions have been established as potentially more traumatizing than first trimester procedures for many reasons. Failure to report critical information increases suspicion that the near limit group was in no way representative. And then the third big issue is the group of women who had abortions near state gestational limits included women for whom the legal cutoff ranged from 10 to 27 weeks, ignoring the fact that women's reasons for choosing abortion and their emotional reactions to the procedure are going to differ based on the point in pregnancy. Women aborting at such widely disparate gestational age should never be lumped together like that. Sampling data is not provided. Of course not. The authors do not explain how the sites were actually chosen, nor do they explain what type of sampling plan was employed. Further, it's not clear why only those identified with the National Abortion Federation were used. No information is offered regarding what cities or areas of the country were sampled from. All mental health measures are very simplistic, with 2 variables containing only 6 items. This is inexcusable given the many psychometrically sound, multiple item surveys available in the professional literature. Ethically responsible sciences do not extrapolate from minimalistic assessments to women's emotional reactions to one of life's most challenging decisions. These particular results were published in JAMA Psychiatry, top journal in the world, with ridiculous assessments of the outcome measures. The 2013 New York Times Magazine article titled "What Happens to Women Denied Abortion" by Joshua Lang, I was interviewed by him, he ignored basically everything I said, provided early coverage of the Turnaway study. This piece is highly slanted and embraces data based on the extremely poor methodology, yet when I revisited it, I looked back at it just in preparation for this talk. What I found most disturbing wasn't the words, it was the faceless, dark images of motherhood that were part of this story. There you go. The NAS committee briefly described results of reviews of the literature also. So they focused mostly on the Turnaway study, and then they talked about the worn-out American Psychological Association, APA Task Force on Mental Health and Abortion report, and the UK National Collaborating Center for Mental Health reviews. I've extensively critiqued those, and if you're interested, the critiques are on the We Care site. There's the address there. But when we look closely at the protocols for selecting and analyzing individual studies utilized by researchers affiliated with these 2 organizations, there's substantial evidence of bias and inappropriate scientific methods invalidating the similar conclusions that these 2 major organizations arrived at, specifically that mental health problems for women with an unwanted pregnancy were the same for abortion and birth. So now we'll turn. There we go. I love that one. All right. So there is a long-standing need relevant to conducting a thorough examination of the world literature on abortion and mental health. And to do so, we need a well-validated assessment tool that can be applied uniformly to every single study published. In 2011, I published a meta-analysis and included every study that fit criteria. There were 22 studies, and I covered a 15-year period. But beyond that, what we just really need to do is have a tool and there is a copy of the assessment tool that I developed, and just apply it to every study ever. And then when we are debating in court about what the evidence really shows, we'll have the only systematic analysis. So I did pull studies published over the last 25 years. And let me just summarize my results here. The assessment tool is actually a scoring rubric, and a copy of it is floating around out there. This approach offers a rigorous alternative to the subjective, politically motivated reviews populating the literature and relied upon by the NAS. 9 widely recognized scientific criteria and anchors ranging from 0 to 4 result in potential individual study scores of 0 to 36, with higher scores indicating a stronger methodology. So these are the criteria used, widely recognized across various topics of study. It's not just studies related to abortion and mental health. So they're all of these studies, and I was able to identify 75 studies. We address the quality relative to each of these components, the sample size, how generalizability the results are. When we talk about generalizability, we're talking about the extent to which the sample on which the study results are based adequately represents the population in terms of demographics, personal situation, and reproductive history factors. Consent to participate or initial response rate was so low with the turnaway studies. Also, the concealment is a big problem in the research literature on abortion and mental health pertaining to concealment, because women don't want to reveal the fact that they've had an abortion. So we have that's another item on the rubric. Confounding control. Variables likely to be systematically related to the choice to abort that are measured and held constant between groups of women who undergo an abortion procedure and those who don't. We also have, we'll look at control groups, which are, I'm sure you all know what a control group is, but it's a group of participants who have not experienced an abortion. It's hard to find anything humorous on this topic, but I did my best. Measures an assessment of the validity and reliability of the instruments used to comprehensively assess the outcome variables. And if a study is ideally prospective, where you follow the women before the abortion occurs, through the abortion procedure, and afterwards, to assess those mental health outcomes. And then the attrition rate, which was so high with the turnaway studies, the percentage of participants who actually withdraw from the study. Given the NAS committee's minimalistic and skewed analysis of abortion and mental health, there was this urgent need for an exhaustive, systematic review of the literature using these established methods. So to this end, I compared the methodological rigor of studies suggesting women who abort are at an increased risk for mental health problems to studies suggesting they're not, using the newly developed rubric. So this is just a little bit about my methodology. I looked in PubMed, Google Scholar, and then the university's based search engine to identify studies published over the last 25 years. These are some of the search terms used, all of the search terms used. When the same data set was analyzed by one research team, resulting in multiple journal article publications, only one article was included in my review. This is standard practice when conducting a literature review, because failing to do so gives too much weight to a particular sample of women. The NAS committee ignored this basic standard, focusing on 7 studies, 5 of which used that same data from the Rotten Turnaway study. So here's basically the results, and this will be published hopefully in the next, I'm not sure exactly, because we're working on publishing several papers with issues in law and medicine, and but anyway, hopefully this will be in the peer-reviewed literature within the next several months. Well, 2 raters separately scored the 75 studies. I had a student helping me all last summer, retrieved using our new scoring review. So 75 studies were retrieved to apply this new rubric to. A total of 49 studies, which is represented just over 65%, had results wherein the overall pattern of the data indicated that abortion increases risk for mental health problems, whereas 26 studies, 34.7%, provided data suggesting abortion does not increase risk for mental health problems. The results show that not only are there nearly twice as many studies indicating abortion increases risk for mental health problems compared to studies with null findings, but the most rigorous studies published to date reveal abortion is a substantial contributing factor in women's mental health problems. The average total scores for studies indicating abortion increases risk for mental health problems was 22.56, whereas the average score for studies indicating that abortion is not a risk factor for mental health problems was 18.35. The difference was statistically significant, demonstrating that the strongest studies available in the scientific literature show abortion does increase risk for mental health problems. And then this difference can be converted over to a percentage, 11.69%. The average scores for each of the 9 criteria are provided in a table in just a minute. The 3 criteria with the greatest differences observed between studies showing abortion operates as a risk factor for mental health problems and those that did not were generalizability, consent to participate, and attrition. All 3 of these elements, when compromised, lead to sample results that cannot be realistically applied to the general population from which the participants are drawn. When generalizability is low, the initial sample does not mirror the population in critical ways related to background characteristics, prior experiences, and current situational factors. When the initial response rate is low, non-participants are more likely to desire to avoid discussion with an investigator if they're harmed psychologically from an abortion. And when there's high sample attrition, there's substantial probability that those who withdraw are systematically different relative to the outcome assessments compared to those who remain. So here's the basic data comparing the studies that did show an adverse consequence of abortion or adverse association and those that did not relative to each of those items in the rubric. The analysis was comprehensive and included all studies without initial methodologically based qualifying criteria, resulting in total scores ranging from as low as 12 to as high as 32. Therefore, closer attention to the strongest studies is merited, as the poorer studies really should not be relied on. Studies with scores at or above 27 would indicate an average individual criterion score of 3, representing good, across the 9 study features. These are the studies with the most rigorous methodologies, worthy of confidence in the results. Only 3 out of 26, which is 11.5% of the no studies, achieved a score at or above 27, whereas 16 out of the 49 studies, or 32.3% of the yes studies, achieved such a high total score rating. There are 9 criteria. Therefore, it's possible to achieve a total score as high as 28, with as many as 2 of the 9 criteria receiving scores of 0 or poor. All 9 criteria are essential quality indicators, and when even one is rated 0, the study should not be heavily relied upon, as a rating of 0 in virtually any criterion category could be construed as a fatal flaw. None of the 16 highly rated yes studies had any zeros, whereas one of the 3 highly rated no studies had a 0. On the other end of the spectrum, any total scores at or below 17 are considered inadequate, because this indicates the study fails to achieve an average criterion score of 2, or which representing adequate, across the 9 study features. In the no group, 13 out of 26, or 50% of the studies, had average quality scores at or below 17, whereas only 12 of the 49 yes studies had such compromised scores. So this exhaustive analysis of studies spanning 25 years, based on 9 essential criteria, sheds light on the heart of the debate regarding abortion as a predisposing factor for psychological harm. The undeniable conclusion, entirely averted by the NAS, is that abortion does, in fact, increase women's risk for experiencing a range of mental health problems. This analysis will prove invaluable to efforts to enact and defend responsible litigation geared toward preserving the health and well-being of women and children. Thank you.